I'm a professor in the Academy of Ambulatory Foot and Ankle Surgery, and this morning I want to show you a patient we performed some minimally invasive surgery on to get rid of a chronic ulceration on the hallux. This is a surgery I've done multiple times and has a good result in the majority of patients. If you look at this foot, this is now about 2.5 months later. He had a fairly significant ulceration which was tracking down to bone. And this ulcer was here for months before we saw him, and he had went through all kinds of treatments for this without any resolve in this ulcer. Obviously the ulcer was a part of a biomechanical issue, and we approached this through several different little procedures. The first step of the procedure, we come to the under the volar aspect of the first metcuneiform joint, and we make a stab incision here with a 67 blade and perform a percutaneous plantar fascial release. And that'll give us some dorsiflexion of the hallux. The second thing we do is come to the plantar aspect of the hallux here and perform a percutaneous stab incision, and we clip the flexor lucis longus muscle. We leave the brevis intact so the patient can still plantar flex. And in the third part of the procedure, we make a percutaneous incision on the medial aspect, and we perform a bony kessel, which is basically a wedge osteotomy in the hallux and pulls the toe up. So this patient had this ulceration for several months, and now we're here only a couple months or so later, and we have complete resolve in the ulceration at this time. Now this guy here is a fairly, I'm 6'1", this guy's 6'10", he actually makes me look like I'm small, and this type of ulceration is a pressure related thing, so he's a very active guy and very large guy, and able to, we got him back to his daily walking, which he's doing to control some of his diabetes. And we're just going to speak to him real quick and talk to him. Now this ulceration was, how long did you have it before you saw me? It started in what?
April.
April.
Yeah.
So it was in April, so we saw him, he had this for at least 6 months or so right at it.
Yeah.
So before.
Yeah.
Let me ask you this, how quick, as far as the treatments we did compared to the treatments that were done before, what were you think? Do you think our treatments were a lot quicker results?
Yeah. Yeah.
So,
yeah.
were you happy with how quick this healed for you?
I was surprised.
Were you?
Yeah.
Yeah, I think a lot of people are surprised at how quick this heals, because one of the things we have to kind of consider is that when we're doing ulcers for diabetic patients, most of this is a biomechanical issue that causes this, and we have to address the biomechanics. Once you address the biomechanics, the ulceration resolves in most of the patients. You don't want to lose a big toe, you don't want to amputate big toes, because that causes obviously transfer of pressure in other parts of the foot, and then leads to other amputation. So once you take the big toe off, even part of the toe, you're going to cause all the ulcerations in the foot. So this procedure here maintains the plantar flexion position of the hallux, allows for normal ambulation, and allows to keep offloading off the other parts of the foot so you're not transferring ulcerations.